Bismillahirrahmanirrahim. Bismillahirrahmanirrahim. Today we will be discussing causes of sudden and gradual loss of vision in one or both eyes, and we will try to keep this discussion small and concise. In between, if any one of you needs to ask any question, you can stop me there and then, and I will try to answer to your questions. Now, let's start with the most important thing. And as a general rule, whenever you start with the basics and the most important things, not from the rare things. So, first of all, causes of gradual loss of vision, unilateral or bilateral. The most common cause in old age is cataract, which is called Sfed Motia in Urdu. Cataract is not a disease but an opacification of the crystalline uh, transparent lens into white opacity, like our hair get white. So it causes gradual, painless, blurring of the vision, usually in both eyes. Now, usually after 60 or 70 years. Now, for example, if I change this scenario, decrease in the vision in both eyes, I'm trying to tell you the causes in the way so that you can make and compare the scenarios and make a conceptual uh, image in your minds. If the person's age is 25 years old, or if he is a medical student and he comes with the same complaint, the first thing which should come into your mind should be refractive errors. And in refractive errors, if he is complaining of decrease in the forevision, then it is um, most likely myopia. Okay, so this is the effect of age. Now here want to clarify that presbyopia, which occurs around about at the age of 40 years, is because of loss of accommodation, for which we have to give the reading glasses for near, which are of plus number, and myopic patients are given minus number. So presbyopia is not a refractive error. Don't confuse it with senile cataract or myopia. It is a totally separate entity. Reading glasses, because accommodation is lost, so we have to magnify the small words. For magnification, we have to give plus number, obviously, because minus number will, when you will see with minus 2, you will see the word becomes smaller. With plus 2, it becomes magnified. So, it is presbyopia means age related decrease in the near vision. Okay, in the near vision, and it is not a refractive error. Refractive errors are only three. One is myopia, other is hypermetropia, third is astigmatism. Okay, now what are the other causes of decreased vision? Gradual decrease vision after the most common being the cataract. If the patient is having inflammation of the iris or uveitis, anterior uveitis, if ciliary body or choroid are also involved, then these are called intermediate and posterior uveitis, the middle layer. It will cause blurring and gradual loss of vision, and it will be accompanied with dull pain. Dull pain. Cataract is a painless condition. Uveitis is the inflammation of the uveal tissue, and on slit lamp you will find inflammatory cells and KPs and other things, and it is treated by topical steroid eye drops and cycloplegics like cyclopentolate and atropine. Then uh, we come to the sudden loss of vision. Uh, there are quite a few causes of, as I told you, that we will make this session small so that you can remember it. Complications of diabetic and hypertensive retinopathy, or you can say complication of vascular diseases of the retina. Okay, and before that, from anterior segment, the involvement of the cornea can cause both gradual and sudden. For example, corneal ulcer. Because of bacterial corneal ulcer, viral corneal ulcer, or whatever, it can cause gradual loss of vision with pain. It is painful. Pain is moderate to severe, and it can cause sudden loss of vision depending upon where is the corneal ulcer, in the center or in the periphery. Are you getting my point? If it is the periphery and moving towards the center, it will be causing gradual painful loss of vision unilateral usually, and if it is in the center, it will cause sudden loss of vision. Uh, then after cornea, we have discussed uveitis. Then come to the retina. The complications of hypertension are usually overlooked by general population. Hypertension itself does not uh, affect vision as such. If only it can slightly blur the vision, but its complications can drastically decrease the vision. For example, number one, it can cause hypertension can cause, because of atherosclerosis, central retinal vein occlusion, which is called CRVO, very common. The whole of the retina, including macula, will be will be covered by flame-shaped hemorrhages, and patient will have sudden painless loss of vision in one eye. Similarly, hypertension can cause central retinal artery occlusion. It is more grave condition. Central retinal vein occlusion resolves itself usually between 3 to 6 months, and if sometimes we give an anti-VEGF injections like Lucentis or bevacizumab, uh, anti-angiogenic factors, but it dissolves itself also. But central retinal artery occlusion is usually happens with the blockage of by an embolus, and like the heart attack, we have 24 to 48 hours to intervene, and in 90 over 95 90 to 95% of the cases, uh, uh, we are unfortunately not able to dislodge that embolus and patient loses the vision forever. Central retinal artery occlusion. Sudden painless loss of vision in one eye, especially in younger patients, in central retinal artery occlusion. So, central retinal vein occlusion, central retinal artery occlusion, then BRVO, branch retinal vein occlusion. If not central, any branch can be involved. Similarly, any branch of the artery can be involved, branch retinal artery occlusion. Are you getting my points? So, these are the diseases behind which the consequent etiological factors are hypertension and hypertension or diabetes or both of them, which are making the blood vessels fragile. Apart from these straightaway diseases, then come to the diabetic retinopathy itself. We usually divide it into three parts, classify it into three parts, which is a basic classification. Uh, One is background diabetic retinopathy, other is second is pre-proliferative, third is proliferative. But now the new classification is from ETDRS study, which was conducted, and it is now classified as non-proliferative and proliferative. But the thing to remember regarding our topic of loss of vision, it can cause gradual loss of vision if there is macular edema. I am not going into details of what diabetic retinopathy does in the retina. We will discuss when we will study the diabetic retinopathy. But it can cause gradual loss of vision because of secondary diabetic macular edema. It can cause gradual loss of vision because of uh, small hemorrhages uh, and exudation on and around the macula. It can cause sudden painless loss of vision because of vitreous hemorrhage, uh, secondary to new vessels which are formed in diabetic retinopathy. So diabetic eye disease is, if not treated properly, is a potentially a blinding disease, and if treated properly in initial stages, it is usually totally treatable, and then other causes which cause sudden loss of vision is retinal detachment, especially people with high myopia, like more than -6 diopters. Because in high myopia, the eyeball is large, retina, every layer of the retina is thin, and supratemporal part is more prone, and a tear is formed. Tear mean ragma mean tear, and that is called ragmatogenous retinal detachment. And other two types are proliferative retinal detachment, which occurs in diabetic retinopathy, and the third one is exudative retinal detachment, which occurs in diseases like posterior scleritis, which secondary to inflammation, they cause exudation, and uh, uh, exudation comes into the subretinal space and separates the retina and cause the sudden loss of vision. And there are many other causes, but these are the major causes of sudden and gradual loss of vision which should come into your mind. Besides trauma, blunt trauma, penetrating trauma, foreign body, chemical injuries, road traffic accident, these are the things of common sense, and there are some other things uh, which we can discuss in some other session, or you can read in your books. These are the things which you must not forget. Thank you very much.